So what if you've tried therapy, but your pelvic floor symptoms are still there? Sometimes therapy doesn't address the why behind the dysfunction. And that's a very good point here. So let me explain to you some of the common reasons why therapy stalls. A lot of times the focus is not on the right thing. So we're only focusing on doing kegels versus there are a lot of other things that need to happen. Plus, are the kegels being done right or wrong? Those are all factors that need to be clarified. A lot of times we ignore posture and rib cage position. We're too busy trying to go in and relax the area. We're not addressing the why behind the cause. There is a lack of coordination in daily movements that's happening that you're not even aware of, and it's hardly being addressed. A lot of times it's the same isolated areas that are being prescribed to patients, whereas the issue is not in isolation. The issue is in collection. Movement is like a concert where the spotlight may be on the one musician, but the background musicians are still playing. Exercises should involve the whole body with an awareness of the whole body functionality, proper function, while there is a spotlight put on a specific area. So I am a huge fan of developmental exercises. A whole body assessment and not just the pelvic floor should be addressed. So incorporating developmental exercises are very important. Now, what are developmental exercises and why are they the best exercises? Developmental exercises are what we have come up with by studying human movement, studying babies from the time they're born until they become running toddlers. So we all are born barely being able to hold the weight of our heads, and then we become running toddlers. There are things we do as babies that we stop doing as adults. That deviation from ideal happens as a result of lifestyle choices, like going to the classroom and sitting for hours, habits like playing video games or watching TV and our devices, to lifestyle choices we make, like what kind of exercises we do outside sitting and playing video games, or I don't know, in cases of, let's just say, sexual function, what positions or what masturbation positions do people choose to do? Those all impact your functionality. I'm not a sex educator. I'm not a judge of is this lifestyle ethical or moral or not. I'm just pointing things out from biomechanical perspective. When it comes to developmental exercises, we start from the floor. So you're on your back and you start on the floor and you start doing certain movements that are universal. We all have done them ourselves. So what ends up happening is you start from the floor, you then gradually, once you build what needs to be in place, you then go to movements that you're on your side, and then you go against gravity, and then you stand up. There's a progression. First thing needs to be in place before the next thing comes in. So that seems to be a manual of movement. If I have an issue with stability of my pelvis that is leading to dysfunctional presence of these muscles here that then employ burden on the organs and tissues that reside here and anything else that's connected, it seems like stability should be in place first. We start with biological breathing. Biological breathing, if you have not subscribed to my channel, which I strongly suggest you do now, biological breathing is how we breathe, and this is how we naturally relax these muscles, and we encourage these muscles to work together and contract in the process of breathing out. So at the frequency of every breath, you're doing this conditioning. That's not Kegels or reverse Kegels. That's the name of some dude who came up with some version of trying to do this. How do you know you're doing it right? How many times have you done Kegels and you've realized, oh my gosh, this thing's making it worse? That's because you're not doing it right. Why concentrate on some rendition of what ideal is when we already know what ideal is? And we can change that by optimizing our breathing. There's a lot more to it than the tonicity of these muscles, which I'm not going to get into. That's why you should subscribe to the channel, because I think, I can't remember, but I certainly hope I have explained these a lot more in the video that I did about biological breathing. We'll make sure we put it at the end of this video. But back to what we were talking about, addressing these things have to happen. That's how you make a change that lasts as long as you know what you're doing, which means your provider needs to explain to you, like we explain things to colleagues, like we learn in school, which, by the way, they didn't teach us in school. As a side note, understand that your stress, your health concerns, and your lifestyle do play a role. So this is not a linear equation. I did this, therefore this happened. There's a series of things you might have done that have contributed to it. The reason pelvic floor therapy did not work for you, as far as the symptoms are concerned, is because it did not address the right whys. Thank you so much for watching, and until next time, take care.